We often get asked by moms how much to feed their babies and how often they should be nursing. And it's kind of an individual question because it's hard to know, especially in nursing babies, how much milk that each mom is making at any given point. So the rule of thumb for babies is that most nursing babies will eat about every 2 to 3 hours or 8 to 12 times in 24 hours. So they should be able to go in at least 2 to 3 hour stretches. Having said that, occasionally babies will do what we call cluster feeding, where they'll eat 2 or 3 times pretty close together. But then after that, or before, either right before or right after that, they should give a pretty long chunk where they don't need to eat, saying like 3 to 4 hours without needing to eat. Nursing times can vary anywhere from 5 minutes to 20 minutes, just depending on how much milk a mom has and how quick the milk lets down. If there's any question that the baby's not eating enough, some good signs are how they're making wet and messy diapers. So babies should be making at least, by the time they're 5 or 6 days old, at least 5 or 6 good wet diapers a day. They should be, especially nursing babies, stooling several times a day. If those things aren't happening and there's any questions at all about nursing, it's always wise to go in and be seen by the pediatrician so you can just get a weight and make sure that the nursing's really going okay. The best barometer of how much a baby needs to eat is, are they growing? As far as actual ounces, if the baby's bottle feeding, it is true bottle-fed babies can sometimes overfeed if you just fill up a bottle and let them drink, because they may suck and kind of drink faster than they really need to. The way to prevent that is not to limit the number of ounces that you give your baby, but to put the amount of milk that you think they might need in the bottle, and then to stop them periodically. You don't necessarily have to burp them, but just take the bottle out of their mouth, give them a little break, maybe set them upright for a second. And then go ahead, and if it seems like they're still rooting around or interested in eating, offer the bottle back. And if they'll take the bottle back, they probably still are hungry and do need to eat more. If they seem satisfied, that's when you want to stop. Usually in the 2-week age range, most babies are taking somewhere between 1.5 to 3 ounces every 2 to 4 hours is kind of an average. By the time babies get to the 2 to 4 month range, most of them are at 3 to 5 ounces. Every 3 to 4 hours, eating probably 6 to 8 times in a day still. And as they get older, they'll just eat, as we start to introduce solids, they'll eat less formula or breast milk, more of the solids, and they usually stick around the 4 to 6 ounce range, but will eat fewer times as you add the solids in. So by 6 months, kids are eating about 5 to 6 times a day, and by 9 months, probably 3 to 4 times a day, and you're just increasing the amount of solids as you go. So the best rule of thumb, though, is just to pace your baby, give them breaks, and see if they're still interested. If they're clearly still rooting, going ahead and giving them a little bit more, either breast milk or formula. If they seem satisfied, stopping and making sure that they're making good wet and poopy diapers.